Can we have a completely transparent conversation about lactation insurance for just a minute? Because honestly, it's super confusing, and it's confusing enough when you've had 8 hours of sleep, but trying to understand it after you've just pushed a baby out of your vagina and you're surviving on, 3 cups of reheated coffee. Maybe you've slept for 4.2 seconds, your nipples hurt, your baby won't latch, and somebody just hands you this big explanation of benefits and it doesn't make any sense. So I want to explain how it works. One of the biggest misconceptions that I hear is, why did I get 2 insurance claims? Why am I getting double billed? Are you billing me twice? And the answer is no, we're not billing you twice. So if we see a mom and a baby, and we almost always see a mom and a baby, it's pretty common, we bill for both mom and for the baby because breastfeeding involves 2 different patients. So I'm evaluating mom's health, milk production, breast health, medications, feeding goals, all of that. But I'm also evaluating your baby's weight, oral function, feeding skills, milk transfer, growth, medical history, all the things. And those are 2 very separate medical evaluations. That is not double billing. It's the standard way that lactation consultants bill insurance because we're caring for the breastfeeding dyad, 2 people. Now, here's where things can kind of get a little confusing. We bill every single family the same way, but your insurance is going to process every family differently. That's the part that nobody really talks to you about. So you might have Aetna, your sister might have Aetna, your neighbor might have an Aetna plan, but all 3 of you can have completely different coverage. I know it seems crazy. The thing on the card looks the same, but it can be different. And that goes for Blue Cross Blue Shield, United Healthcare, all of them. And Blue Cross Blue Shield is not just one plan. It's hundreds of plans across the country. Some cover private lactation consultants. Some only cover lactation when it's provided through a hospital facility. Some cover mom and baby. Some only cover mom and lump in baby. Some plans have deductibles, some don't. Some have visit limits, some don't. The tricky part is that we don't get to decide any of that as your lactation consultant. And unfortunately, your insurance company usually doesn't tell us exactly what your responsibility is going to be until after they process the claim. I wish they did, but they don't. And it's really confusing for parents. So if you have Aetna, we're going to use that as an example, there's another little wrinkle with that particular company. Many Aetna plans offer unlimited lactation visits. While that's true, some of those plans will limit how many times a certain billing code can be used for your deductible or to have co-insurance apply. So the crazy part about that is you may have already used some of those benefits before you ever come see me or one of my partners. So maybe you took a breastfeeding class through Aeroflow. Maybe you attended a prenatal breastfeeding class at the hospital. Maybe you saw a lactation consultant in the hospital after you delivered. Depending on your specific plan, those visits may all count toward the same benefit. So most parents have no idea that that's even happening. Why would you? This is really confusing stuff. But here's my advice. If you're worried about what your visit is going to cost or what it might cost, I want you to call the number of the member services on the back of your insurance card. And don't ask, do you cover lactation? Because it's too broad. Most of them are going to say yes. They don't have a clue what they're saying anyway half the time. Instead, you're going to say, if I see an in-network lactation consultant for breastfeeding support, do I have lactation coverage? But then we're going to get more specific. Then you're going to ask whether these codes are covered and whether you'll owe a deductible, a copay, or coinsurance. So those codes are S9443, 98960, 99404. You're going to ask whether you have limits on any of those codes. You're going to ask whether you've already used any of those benefits through breastfeeding classes, hospital visits, or another lactation provider, or Aeroflow. And you're going to write down the representative's name. You're going to get a reference number for your call. And honestly, if your state allows call recording, I would consider recording the conversation for your records. Texas, for example, where I am, is a one-party consent state, but recording laws vary, so be sure to follow the laws where you live. I hate that I even have to say that, but after years and years of working with insurance companies, I've learned a thing or two. And I've learned that it's always helpful for me to have recorded the conversation, because sometimes you'll get a different rep on the phone and it will be a different story. So it's helpful to come back to. But finally, if you ever receive a bill that doesn't make sense, and when I say a bill, I mean an explanation of benefits or an actual bill, please do not panic and don't assume it's right if it came from us. Please also don't pay it before looking at your explanation of benefits and reaching out to us. Send us both of those things. We'll happily review them with you. If something doesn't look right, we will work with our billing partner to get answers if we're using our billing partner or if it's from us directly in network. Our goal isn't just to help you breastfeed, it's to help you navigate the entire process, including the insurance side of things. If this was helpful, save this video, share it with another breastfeeding mom, and download our free insurance cheat sheet. I'm adding that below. Actually, if you just comment the word insurance, I'm going to set that up so it can be sent to you. So comment the word insurance and you can get our insurance cheat sheet. But this video is all stemming from this week we got a review, and to be honest, it's the only non-5-star review we've ever received, and it all had to do with insurance billing. I've reached out to the person who left it and haven't heard back yet, but I think there was a misunderstanding about insurance, and we are always very as clear as we can be. But the thing is, we don't want to overwhelm you with all of this right in the first email of like, hey, you're covered, we're in network. You just want the visit. You're not looking for all of the disclaimers about the insurance. So everything is always included in our consents that you sign. So read those. It goes over as much as we can possibly tell you. It gives you your instructions of what you can do. But sometimes, we understand mom brain, postpartum, you're tired, you're exhausted, and you don't necessarily always read all of the fine print. We're not doing anything to hide any of this by any means, but it can be confusing, and we understand that. So we just want to help. So if you're needing, even if you're not one of our clients, but you need help understanding insurance, feel free to, type the word insurance in, drop the comment below, and we'll send you our guide to understanding your insurance plan a little bit better. I'm hoping this helps.